everyone, I'm Rhea Valerie Ayabobo, a student nurse of Pan Pacific University. So today, I will be performing a head-to-toe assessment or complete physical examination. I wash my hands first. And gather all the equipments that needed for the procedure. Good morning, ma'am. I'm Rhea Valerie Ayabobo, your student nurse for today. So what is your name and date of birth?
Karen Fernandez, November 5, 1997.
Okay. After we ensure that we have the correct patient in front of us, we can now proceed to explain the purpose of the assessment. So, I'm here to perform the head-to-toe assessment or complete physical examination. It will be starting by getting your height, your weight, and checking your vital signs. I will be also assessing your head, your neck, your facial features, your lungs, your heart, your abdomen, your upper and lower extremities, and your neurological function. So, why we do this? We do this in order to ensure that there's no abnormalities or that everything is normal. So, before we begin, let me ask you some questions. Have you noticed any problem with your skin?
No.
Okay. Any problems with your facial features?
No.
Your visual and hearing?
No.
Any problems with breathing?
No.
Locomotion?
No.
Movement?
No.
Okay, that's great. Do you feel any pain right now?
No.
Okay. So as I am assessing your general status, so all we're gonna do first is getting your height and weight. Can you please stand up? Go there.
Yeah.
Okay, your weight. Okay, good. So we will be comparing your height and weight in your previous medical record, okay? And now I will be checking your vital signs, and we go first by getting your temperature, okay? Okay. And the client temperature is 36.5, which is normal. And now we proceed to get your pulse rate. Give me a hand. And the pulse rate of the client is 88 beats per minute, which is normal as well. And now we proceed to get the blood pressure. And your BP is 120/80, which is normal. Okay. Do you have any question before we proceed? Stop. So the first thing we can do is to inspect your head, your neck, and your facial features. As I'm inspecting the head, the neck, and the facial features of the client, it seems normal. So afterwards, we can now also proceed to check the facial movements of the client. Can you raise your eyebrows? Smile. Puff out your cheeks. Okay, good. We're going to proceed to palpating the skull, the ears, and the nose of the client. Do you feel any pain as I touching you? Okay. Ears. And to the chin. The nose. Afterwards, you're going to assess the eyes of the client. So first, you're going we're going to shine a light. Okay. So afterwards, we're going also to assess the pupils of the client. The pupil should be round, should be equal. Okay. Pupils of the client are equal and round. Now we get our pen to assess the accommodation reflex. As I'm going to move towards and away from your nose, you just follow it, okay? Okay. Okay. And now we're going to assess the ocular movement. You just follow my hand without moving your head, okay? Okay, good. Now I'm going to perform the whisper test.
Pen. Pineapple.
Okay, good. So now I'm going to assessing your difficulty in breathing. Can in, out, in, out. Do you find difficulty in breathing? Okay, fine. Can you say out for me as I'm going to assess your throat? Assess your throat. Say wider please. Okay. So there's no sign of smelling and no sign of infection of the tongue, so that's great. And now we can move to the neck of the client. So before we start, let me first palpate the left and right carotid artery of the client. Stop. And now we can also palpating the trachea and the thyroid gland of the client. So there is no signs of enlargement in the trachea and thyroid gland. Check your neck movement. Can you move your head up, down, left, right? Do you feel any pain?
No.
Okay. Now as we're going to assess your heart, your lungs, and your breast, any question before we begin? Okay. The first thing we can do is to inspect the client breath. We want to assess the accessory muscles used as well as the symmetry expansion during respiration. Can you breathe in and out? Breathe in and out. Okay. Can you face here with this for a while? So we can now palpate the back. Breathe in, breathe out, 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 breathe in, breathe out. We can now also proceed to auscultate the posterior thorax of the client for the lung sound. Breathe in, breathe in, no. 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 Okay, that's great. So after assessing the posterior thorax of the client, we can now move to the anterior thorax of the client. So we will be doing the same as I do in the posterior thorax, okay? So let's just inspect for the skin lesions. Okay? There's no skin lesions. After the inspection, we can now proceed to palpation. So I'm going to your anterior thorax. Okay? Breathe in and out. Breathe in. Breathe in and out. Breathe in and out. Can you say 99?
99. 99, 99, 99.
So after that, we can now proceed to auscultation. Can you do what to do what? Okay. We want to hear the heartbeat using the stethoscope. Stop. It seems like the heartbeat of the client is normal. And assessing your breast area, can you sit like what I did? And can you raise your arms like this? Okay, good. And now I'm going to invite you to lay in the bed to assess your axillate, your breast, and your abdomen. And now we are assessing the axillate, the breast, and the abdomen of the client. You may now lay down. Lay down. First, we want to do is to inspect the axillate to the breast area, and afterwards, we can now proceed to palpation. Can you raise your hand like this? Okay. So we're going to palpate the axillate, going to the breast. So we're just trying to feel if there's a cyst or any bumps. The other side. Okay. So afterwards, we can now proceed to the abdomen of the client. So the first thing that we can do here is to inspect the abdomen for any signs of discoloration or lesions. So can I raise your shirt, mom, if it's okay? Okay. Let's see if there is sign of a lesions or discoloration. So as I inspecting the abdomen of the client, there's no sign of discoloration or lesions. Okay. The next thing to do is to palpate the first quadrant of the abdomen. We're trying to assess for any tenderness. Do you feel tenderness here? So after assessing or palpating the first quadrant of the abdomen, we can now proceed to osculating the first quadrant of the abdomen. We just want to hear a vowel sound, if there is. So there's no sound of vowel. So after auscultating the abdomen of the client, we can now proceed to the upper and lower extremities of the client. Are you still fine?
Yes.
Are you comfortable?
Yes.
Can you raise your arms like this? Shake it. Do it also in your feet. Wiggle. Okay, perfect. I'm going to proceed to do the dull and sharp test. Just give me your hand. So if you feel this, it should be sharp. And if you feel this, it should be sharp. Okay, did you get it? Okay, give me your hand. So close your eyes. So you can tell me if it is dull or sharp. Okay?
Sharp, dull, sharp, dull.
The other side.
Sharp, dull, sharp, dull.
Okay. Let me think also. We can do also what we do into your hands, like, okay?
Sharp, dull, sharp, dull.
The other side.
Sharp, dull, sharp, that.
Okay, perfect. And now I'm going to assess my client fingers. And here's I'm gonna checking her capillary refill. And it's look like normal and less than 3 seconds. The other side. It's normal as well. And here as I see my client's fingers, there are no sign of clubbing. And I will be also checking the capillary refill of my client feet. So it's the same as the fingers, less than 3 seconds. And I will be also checking the plantar reflex of my client. Okay. Okay. And my client has a normal reaction. So after assessing the upper and lower extremities of the client, we can now proceed to the last part of complete physical assessment, which is the neurological function of the client. And kindly speak your name
Karen Fernandez,
and date of birth.
November 5, 1997.
What's the color of Ampalaya?
Green,
How about the sun?
yellow.
After assessing all the form of head to toe assessment, we are now done the complete physical examination.